So, these public goods and common resources the first most important point is no excludability, right. For both of these or either of these I am not paying any user fee. So, people cannot be prevented from using it. Using them, but at the same time for public good it may be there is no rivalry in consumption, but for common resources there is rivalry in consumption, right. So, for public good rivalry in consumption, and because there is no price attached to it, there can be an over usage, there can be an under usage, right. And looking at this over usage, under usage, the benefits and then the costs of the government, because under usage means wastage of resources, wastage of potential, so it has an opportunity cost, or the government's budget share is not being utilized properly, or government's budget, so that means there is a cost because it is going unutilized. So, so if there is a question of efficiency or inefficiency, we talk about them in two ways. One is positive externality, and negative externality. Now, what is positive externality? We will discuss in detail about positive externality, but still, what is positive externality? Positive externality is where my social benefit is greater than the cost, often private cost. Yes, what is negative externality? Where my social benefit, or I will write my benefit is lesser than my social cost. Yes, so this social benefit or social cost is not only including private benefit or private cost, but some external benefit and external cost. Now, I am utilizing that, so I have a benefit, but because I am utilizing that, somebody else can also have a benefit, right. So, that together is social benefit, even if they are not paying. So, say for natural monopolies, even if the hospital is paying for this fire protection system, I am also getting a benefit. Even if the hospital is doing some waste management, so people staying around the hospital are being benefited. So, that is the social benefit. Or social cost can be if I have a negative impact on the society, smoking and anything, apart from those who are basically producing or consuming. So, their own benefit, their own cost is the private benefit and private cost. So, when my social benefit is more than my private cost, or eventually social cost, if you can take care of the external cost as well, then there is a positive externality. And when the benefit is less than the social cost, then there is a negative externality, and both this can occur out of public goods as well as common resources. we will learn how. Yes, the first problem what public goods face is free rider problem. Is a free rider problem. Now, what does this free rider means? Free rider, that I ride a bike or a car every day, with somebody, with my friend or somebody, but I don't pay for the petrol or the diesel. I don't pay for the fuel, but I am getting a free transportation. Yes, so that is a free rider problem. Free rider. Now, this free rider, by the by the word or by the phrase, it's easy to understand the concept, but basically this free rider problem means because people don't pay, but they also continue receiving the benefits. So it can be defined as person who receives, not this, a free rider can be defined as person who receives a benefit of a good or service but avoids, that means it is intentional, paying for it. Yes, so intentionally I am avoiding to pay for that particular service I am getting. I am just trying to, okay fine, I am just taking this benefit, okay let me enjoy. Yes, so that is the free rider problem. Say somebody has a health card, I am utilizing that for my health benefit, and maybe the person has paid for that health card or he pays a subscription fee. So that is where a free rider problem can occur, and if there is a free rider problem, it discourages the private players to join the market, because then there will be people who are not paying but who are availing those services, right? And that is a loss for the private companies. They are the profit making agencies, so they cannot entertain that the people, they are not paying but availing the services. But it's very difficult to to get rid of, because what happens is when in case of, say, what happened in public goods, a person is not supposed to pay, right? So why this free rider problem is coming? But then just take it simply that the government is paying, the person is not paying, but there is a moral hazard. They are trying to utilize that benefit. What we see, that it is very easy to get a below poverty line card, right? I can influence some people, I get a below poverty line card. In that the data, the survey in National Family Health Survey, it is found that wealth index based on, say, 33 or 34 this the wealth assets, the assets, they have estimated the wealth index. It can be the fridge, tractor, television, phone, all this land. So they have estimated an index, and it has been found that even there is a considerable percentage of people who are coming from the highest wealth quintile, that the top 25%, 20% quintile, 5 groups, top 20%, they also possess a considerable percentage, I don't really remember that, they also have a BPL card, because there is another question that whether you have a BPL card or not. So it is very easy to get a BPL card. When you have a BPL card, you can avail these health schemes, yes, which are supposed to be those for those who are genuinely under the poverty line, below the poverty line. But who are getting that? Now it eventually increases the cost of the government, and that is where no private company is basically interested to do a charity, or to give this thing, a healthcare to provide the healthcare at a very low cost, because they fear that if they have kept the cost low for certain section of the population, it can be misutilized, and which will eventually increase the cost of their operation, because they have segregated the market based on a target population. Yes, so for public goods it is difficult to exclude, and therefore the free rider problem are supposed to appear, and once there is a free rider problem, the private organizations are completely discouraged from supplying their goods or services in that particular market. But where the government can find a remedy, it's only the government can find a remedy, because if the private, if the government cannot reach to all the people, they expect the private system with quality health system, quality, they will come up, but with this free rider problem they don't, and then again it comes back to the government. They have to find a solution, that whether to keep that a public good or not. How do they decide? The first thing they do, or they try to understand, is one, that whether the total benefit of one public good is greater than its costs, right? Therefore, if the total benefit is more than the cost, then there is a significant impact on the society, or it's considerable. Then they will continue with the good, keeping them as non-excludable. That means a public good. And otherwise, if they find that the benefit is actually lesser than the cost, because eventually those who are utilizing them, they are not supposed to utilize them. Now, if a 2 rupees rice, kg rice, are supposed to be distributed for those who are marginally poor and finally are being enjoyed, or being shifted to the private market, and then they being enjoyed by those who don't really require them, then if the target was to decrease the malnutrition, yes, the malnutrition doesn't come down, because those who are getting that rice, they are not undernourished. Those who are undernourished, finally they are not getting that rice, or by that amount what they are supposed to get. That means they are remaining undernourished. So the benefit is not increasing. Where the government now, with not much, without seeing any considerable or substantial improvement, the cost, now the government pushes more and more, the cost increases, and then the benefit, it declines. So this can get reversed at the cost is more than the benefit, and then they will decide, no, I am not going to give this benefit anymore. If there is no any political agenda, I am not going to continue with this, because it's no more a public good, and it is not serving as a public good anymore. Therefore, the first thing is that they need to understand that whether the total benefit is more than its costs. The second thing is that pay for it with the taxes. If it has to continue as a public good, pay for it from the tax revenue. Yes, so the cost is actually made up in terms of the or through the tax revenues. And then the third is, if it's a public good and genuinely serves the purpose, then it's good for all. Everybody is better off. Yeah, so it's primarily government's decision, but that whether they will continue with this, with a particular program, with a particular scheme. Can be it a scheme against undernutrition, can be a scheme against anemia, it can be a scheme against social health insurance program, anything, or the maternity benefits, anything. So it has often been asked a question that whether a particular health care, or okay, before that, we try to understand that how the government does this cost benefit analysis, because this is nothing but the cost benefit analysis. Yeah, they're trying to see the difference between the benefit and cost, and if the benefit is more than the cost, then there is a positive benefit. So the government does a cost benefit analysis. In health, as we learned that it's very difficult to quantify health or health outcomes easily or as a single outcome. It's a combination of multiple goods. So when we do a cost benefit analysis, it has often been challenging. So but the government decides based on the how good is the benefit as compared to the cost. And so if we need to keep that the difference between the benefit and cost positive and substantially high, then in what quantity, what commodity has to be supplied, in which areas have to be supplied, in what quantities have to be supplied, everything has to be worked out. But let us take a simple example to learn about how this cost benefit analysis works. Now, so for a public good, we try to estimate both the costs, all costs, yeah, and kind of all benefits together, all costs and all benefits. And if it doesn't have any price signals to observe, then it's a problem, but then we have to take some proxies for that, if there is no price signal. So and often this cost benefit analysis, while we are doing this cost benefit analysis, we kind of take help of approximate estimations. And while doing that approximate estimation, say we let us take a very simple example, that what is the benefit of new traffic signal, a traffic light. Yes, it can be a traffic light, it can be a say immunization program, it can be anything, So a new traffic light, because that traffic light in that particular junction, not having a traffic light, there is an accident in that particular locality. So the government decides, okay, what will I gain if I have a traffic light? So the benefit is increased visibility and safety. Right? Once I increase the visibility and safety, there is a lesser chance of accidents. Lesser death. Now, this road accident is a serious public health concern. Lesser deaths. And we estimate that the proportion of death or the percentage of death because of accident in that particular locality comes down, say from 2.6% to 1.6%. So how much? 1%, right? So 0.01. Right? So by 0.01 unit, the number of deaths come down. Very good. Now, This cannot be, the cost benefit analysis is often estimated in terms of the same unit, and basically it's a monetary estimation. So both the cost and benefit should be monetarily estimated. So once we are trying to estimate benefit, we have to give it a monetary value. Now this is in percentage form, that how many deaths were in 100 deaths, how many we are saving, right? That is 1, 0.01 out of 1. Now, to estimate the human life, we have to attach a human value for that life. For one life, if I save, how much value I can add to. So, or how much value in monetary terms I can save. So, when I am putting a value on human life, I think of several aspects. One is their own productivity, number 1. Number 2 is the compensation needs to be given. Number 3 is the several opportunity costs, maybe the cost of the vehicle, the giving other social security schemes to the family, providing other social security schemes, the monetary compensation, and everything together is the cost of the human life, and that can be the benefit of the human life, right? Because their productivity is a direct benefit, and the opportunity costs are also the benefits foregone, right? So that is a total benefit. So if I can put it, I would say I have kept it like 100,000 rupees, or say it should be more, in fact, yeah, say 10 lakh rupees. Yes, 10 lakh rupees. So if the value of a human life is total 10 lakh rupees, and the probability of saving a life is 1% or 0.01, therefore the expected benefit is probability of death multiplied the value of human life, yeah, say value of human life, which is 0.01 multiplied by, yes, this is nothing but 1 by this divided by 100, so I can keep as 1, 2, 3, 4, 10,000, right? 1/100th of 10 lakhs is 10,000. So 10,000 rupees is the expected benefit of having a traffic light, putting a traffic light. But the cost of putting a traffic light, if it is only say 3,000 rupees, there is a benefit, net benefit of 7,000 rupees, which is nothing but the difference between 10,000 and 3,000. That is my net benefit, and then the government continues as a keeping putting traffic lights in that particular stretch as a public health intervention and a public good. They continue it with as a public good, and then they approve putting these traffic lights. Thank you.